Hi guys, this is an update on how I'm doing on the Paxil. I'm still on 60 milligrams of Paxil. I've been on this dosage for like several months now. I'm doing fine on it. I guess my anxiety levels haven't really changed at all since the last time I updated. So there's nothing like really new to report there. But something that a lot of people have brought up to me before is that don't I know that it's going to be horrible when I finally stop taking the Paxil? The symptoms are just going to be the withdrawal symptoms are going to be awful, etc., etc. And while I don't disregard the withdrawal symptoms that they may have experienced, I didn't really think that I would be at risk of experiencing those withdrawal symptoms if I ever did stop taking Paxil. For, I guess, various reasons. I didn't think that I would be subject to those unpleasant symptoms. But anyway, I had a chance to find out how I would react to stop taking the Paxil earlier this summer in June, because I had a surgery in June. It was supposed to be like a pretty basic, straightforward surgery. It was not patient surgery, day surgery. But then there were a lot of complications, and I ended up having to be hospitalized for several days. And then once I was let out of the hospital, I was still healing. I wasn't feeling very well. So my normal routine was kind of thrown just way out of whack. And I just stopped taking the Paxil because it just wasn't on my mind, and my normal routine was just completely screwed up. So I just didn't think about taking the Paxil. And it wasn't until a good 2 weeks later that I realized that, one, I had been feeling really anxious and I couldn't figure out why, and my head had been pounding, and just I felt really dizzy and stuff for I don't know, a week. I would say that these symptoms of dizziness and headache started about a week after I stopped taking the Paxil. And they lasted for a week. So 2 weeks after I stopped taking Paxil, I was thinking about how much my head had been hurting lately, and how dizzy I was feeling, and wondering why I was feeling anxious again, since I hadn't felt that intensity of anxiety for a really long time. And then I realized that I hadn't taken Paxil in 2 weeks. So then I immediately went back to taking my normal dosage of Paxil, and the headache went away. My anxiety, within a couple of days, my anxiety went back down to the low levels that it's been at since I started the Paxil. And yeah, so I guess what happens to me, I know now what happens to me when I stop taking Paxil is that my head hurts a lot and I feel dizzy. But that was when I stopped taking Paxil, just cold turkey, which is one day I was taking it, and then the next day I just stopped taking it completely. There was no gradual decrease, which is recommended. So, and really the withdrawal symptoms weren't that bad. I mean, it was a headache that I was able to deal with and stuff. So I'm not concerned anymore about when the time does come for me to stop taking Paxil, because I'm okay without it. I'm not worried about I think it's serotonin syndrome is what it's called, when you experience really bad withdrawal from Paxil. I think it's serotonin syndrome. I can't remember. Maybe that's something different. But anyway, so that was I guess it was nice for me to find out what it would be like when I stopped taking Paxil. So if there ever was any reason for me to worry about it, there's not anymore, because now I know how my body is going to react. And yeah, so now I'm back to taking 60 milligrams of Paxil every day. And yeah, that's it for the Paxil update. If you have any questions about the Paxil or anxiety or anything, feel free to let me know. And I really enjoy reading y'all's comments and messages to me, so I If you have anything to say to me, don't hesitate, because I really like reading what you guys have to say. And that's all for now. Bye, guys.